Hi, I'm Tom Crosby. I'm the National Clinical Director for Cancer in Wales. And I'm really here to talk a little bit about the single cancer pathway. Many people will have heard of it. Effectively, what we're saying is that we should accurately reflect patient experience when we report cancer waiting times. And that means starting the clock and the recording and the reporting of cancer waiting times right at the point of suspicion, where a healthcare professional thinks there's a very high chance that the patient may have cancer, and indeed the patient's told that they themselves may have cancer and obviously will be concerned. So we currently have an urgent suspected cancer and a non-urgent suspected cancer waiting times that we report. The single cancer pathway would unify the way we report cancer waiting times to a single measure, starting at the point of suspicion of cancer and finishing when the patient receives treatment. So we were really pleased to hear the Cabinet Secretary and the Health Minister announce in November the intention to publish the reporting of the performance against the single cancer pathway for all patients from June of 2019. So that's really going to put in the fore how the system is performing for all patients with cancer. So what's the system doing about that now? At the moment we're working hard to standardise the pathways of care, something called National Optimal Pathways. And over the next 6 months, we're going to develop a whole suite of those pathways, trying to determine what should happen to a patient at what time in the pathway. I think health boards are working really hard now to implement the single cancer pathway. And we'll all work together over the next year to improve performance against those single cancer pathway waiting times. We're also really pleased to hear that the Minister announced that there would be some resources coming in to support the implementation of the single cancer pathway. So he's announced the £3 million, which is recurrent year on year, to be used by the system to successfully implement the single cancer pathway. So that's a really positive measure. We now need to determine how that money is used, how it's allocated, how it can best be used to improve the patient experience and ultimately outcomes for patients in Wales.